One of the biggest risks in hospice and palliative care is someone getting aspiration pneumonia. Here are some things you can do to decrease that risk. First, what is aspiration pneumonia? This happens to a lot of people who have dysphagia, which is when you have difficulty swallowing or you can't swallow at all. Almost everyone on hospice and sometimes palliative care will eventually get to a place where they have difficulty swallowing because it takes a lot of muscles. Your neck, your mouth, your tongue, all of these muscles start weakening, so it gets harder and harder to swallow. Aspiration pneumonia happens when some of those food particles or liquid particles, instead of going down your esophagus into your stomach, it goes down your trach into your lungs. Sometimes people can silently aspirate, meaning like you don't even hear them choking or coughing because they aspirated. Sometimes you can tell. It's a little easier to tell. They start coughing, they feel like they're choking, but it can be pretty subtle sometimes. So aspiration pneumonia is basically when food or water goes into the lungs and it settles there and eventually turns into an infection. Typical signs you'll see from aspiration pneumonia are going to be fever, a lot of coughing, and some shortness of breath. If someone shows any of these signs and they're on hospice, for sure call your hospice team. An antibiotic may need to be started. If you're not on hospice or palliative care, of course, talk to your doctor. So some things that increase that risk, or people who are most at risk, are anyone that have any kind of disease where their muscles are going to be weakening. Dementia, Alzheimer's, Parkinson's, MS, ALS. Anyone that will slowly have deteriorating muscles will be at risk for this. Stroke, a lot of times people have dysphagia because of stroke. It just depends. And a lot of times people on hospice with any disease, once they're getting very towards the end, like near the transitioning time where they're not actively dying yet, but they're having a hard time taking in food and water, you'll notice them kind of coughing a lot with every sip of water or spoonful of food. If you notice them coughing, that is a sign that they are getting weakened muscles right here and they are at risk for aspiration, which could then turn into aspiration pneumonia. How can you help? That's the biggest thing here, right? People want to know, how can they prevent this or at least make someone less at risk? The main thing will be noticing that someone's getting weak. So if you have a loved one that you're caring for and you're feeding them food or feeding them drink, and you notice with every sip or every other sip, you notice them coughing. That doesn't necessarily mean they're aspirating. That actually means they're probably still protecting their airway, so that's a good sign. But it's a sign to you that their muscles are weakening. That's something you want to talk to your doctor about or your hospice team about. We can usually start something called a thickener, which will help thicken your liquids, because that's the first thing your loved one will be coughing on. Liquids are actually hardest to swallow. So they'll put a thickener in the liquid, make the liquid a little thicker, and then it's a little easier to swallow. So that's one thing you can do to help decrease the risk of aspiration pneumonia. Second, I don't want you to force anything. Remember how I always say, don't force someone to drink or eat or take medication? That is because if you do, they are at risk to aspirate, and then the aspiration again can turn into aspiration pneumonia. So do not force. Always offer food and water. If they want it, great. If they don't force it. All of these things I'm describing to you are something we call aspiration precautions. Your hospice team will likely have a lot of these things in place, so you can always ask them as well. So a lot of aspiration precautions we put in place are things like keep your loved one's head of bed at a 90-degree when you are feeding them or having them drink anything. So that's basically them sitting straight up. So head of bed at 90 degrees will help with decreasing the risk for aspiration. Having them take small bites. So instead of like big meals 3 times a day, small little meals throughout the day. And in those meals, slowly feeding them in small bites. Also, another thing you can do is when they are sipping water or taking a drink or having some soup, after they swallow, have them swallow a bunch of times after that. So small little swallows multiple times. If you are giving medications and swallowing pills is difficult, you can always ask your hospice team if you can crush certain pills. Do not crush pills unless you ask them first, because some pills will be time release that you can't crush. So ask if you can crush them. If you can crush them and mix them with applesauce or something, which makes it easier to swallow. If you can't crush, You can always just take one pill at a time. And again, always talk to your hospice company or your doctor about risk versus benefit. If it's too much risk to try to swallow the pill, maybe don't swallow the pill or be on that medication anymore. It just depends. Especially if you're on hospice, you always want to outweigh risk versus benefit. And last but not least, you can always alter solid food versus liquids. So they take something solid and then follow it with liquid. Take something solid, follow it with liquid. And again, small portions and slowly. At the end of the day, it's all about listening to your loved one. Again, do not force food and water. All of these things are going to help decrease the risk of your loved one aspirating, which will decrease the risk of your loved one getting any kind of aspiration pneumonia, which is an infection and can really cause a swift decline if we're not on top of things. The most common reason for aspiration is from force feeding. So again, please do not force feed or take a syringe full of fluid and try to make someone drink. That's the biggest risk you can give your loved one. So again, at the end of the day, just let them be your guide, let their body be the guide, offer everything you can, and if they want it and can take it, good. If they can't, hold off. Always talk to your hospice company or your medical provider for advice.